Hi, I am Dr. Kim Sage. I'm a licensed clinical psychologist. Welcome to my YouTube channel and to this video and series really about how our relationships are often impacted by the childhood experiences we have and how that sort of childhood need to adapt and understands what the world looks like as a result of childhood experiences, primarily with our caregivers or those around us, how that becomes the map of how we believe life and relationships and our needs and other people's needs and how we deal with our feelings or how we don't, really how we think about things. It truly is why I find it this whole concept of attachment theory to be so compelling and fascinating. Now, like all theories, nothing is perfect, but at the end of the day, it really helps me understand, but not to label. And so that's our goal, I hope is our goal in this Healing Love series. Really quickly, if you're new here, please consider subscribing and checking the little box. And that way you'll get notified when I post new videos. And really quickly, if you are someone who was raised by parents with a very complicated way of relating to you, maybe they were more, classically, as you're reading about narcissism, they were conditional, they were critical or controlling. If you were a reflection of them and your only value was to reflect them and there was like not much emotionality. If you had parents who were sort of like a roller coaster, really great, but then could be really hurtful and say and do really damaging things. It may be that you loved them so much and yet also had so much contempt for them. I'm not just talking about, in adolescence when you're kind of pushing away, but if you're still struggling now and you just feel like it's toxic, but you don't know what to do about it. I have courses specifically on this issue called Healing and Dealing with Borderline and or Narcissistic Parents. And then another course called Remothering Yourself, basically. It's learning how to take that internal child and the internal adult and to set up your life and do some work in healing and have a kind of roadmap for how to heal that little child within. And then one more free course on identifying things that may have happened to you in childhood. So please check all of those out. So today's video is really about how we, in different attachment styles of the four main styles of attachment, secure, anxious, preoccupied, avoidant, or dismissive, and often called disorganized or fearful. These are the styles that are really identified in the literature. And so we're going to talk about how these different styles, what they kind of do when we're having intimacy or vulnerability issues emerging in relationships. And so I just want to go through quickly on what the typical patterns are and give you some research, some quotes of different research studies that have been done around these issues. And we're going to continue to dive further into relationship issues as a result of these kind of childhood stories and wounds. So obviously, when something difficult comes up, something uncomfortable in a relationship, a person with a more secure attachment, of course, they're not going to like that. It's not going to feel good. It can be scary. It can feel triggering. But generally speaking, at some point, they are able to lean in and deal with the uncomfortable feelings, both their feelings and their partner's feelings. Now, oftentimes, of course, it depends on, let's say you're a secure person and you've chosen somebody who is maybe secure with anxious tendencies or is actually avoidant. And so how you deal with that is often going to depend, as this is always reciprocal, on how they respond to you. But we're talking about in this video just your style, what your tendency is to do. So if you're more secure, you're not probably going to love conflict, but you're going to find a way to push through issues you have, and you're generally going to lean towards it. You're going to lean toward a partner's desires, vulnerabilities, expressions, for the most part, not perfectly. But what happens if you're more anxious? If you had a childhood defined by a lot of inconsistency and sort of lack of predictability and responsiveness by your caregiver, if you had a caregiver who over-involved you, as I've described, in their state of mind, and so you often become a caretaker, you often carry a lot of their feelings. Well, when you have a trigger that is something in the relationship that is uncomfortable, actually your tendency is going to be to lean into it in some regard because you have this excessive need for reassurance and this limited capacity for soothing yourself. That's often that outside-in orientation. You're going to quickly want to figure out what that is so you can calm that anxiety down. right? Because any kind of a vulnerability or intimacy trigger is going to feel scary and threatening and potentially make you feel like, uh-oh, this could be the end, or they might leave me or abandon me. And so you're going to be more expressive and more emotional, more of a caretaker, right? To try to help your partner deal with their issues. And at times, because you have this anxiety trigger and oftentimes hypervigilance, you might over-respond emotionally. You might not, but the odds are good when we look at this style that even if we don't show it to you, we are being sort of like elevated in our sympathetic nervous system. But we're going to try to lean in. And so we're generally comfortable with closeness, but we do have these fears of rejection, right, and abandonment. And so the issue for us, though, if we have this, is that because we're often so focused on you, yes, we're going to acknowledge what you feel. We're probably going to lean in and try to make it better for you. We may sometimes, though, in the process, minimize what we need. And so if you have this style, it's actually, in some regards, the positive is that you do want to be a caretaker. It's just that you don't want to lose sight of caretaking yourself. And so if you have an intimacy trigger or your partner's unhappy with you, you're probably going to lean into what's uncomfortable. Just don't forget to always check in also with, okay, I'm being a good listener. I'm trying to help you, regulate, or I'm trying to help your hypervigilance. But I need to also take care of mine. I need to honor what I feel, what I think. And so that's why it's so good to learn to pause. Even if we take a conversation with a partner and we're not really sure how we feel, we want to respond, we pause, we take it in, and then we think about honoring what they're saying, but also honoring what we're saying and what we need. Now, if you have a more avoid style, generally your tendency towards any type of intimacy or vulnerability trigger is going to be to turn away from what is uncomfortable, because that is what you had to do in childhood. Remember, this is a style defined by what's called repeated maternal rejection, which isn't overt rejection necessarily, but is that basically your needs, your emotions, a lot of the feelings in the family system or with the primary attachment figure were often dismissed. And so the things that the caregiver found important, like the conditionality of being a good child, or of more positive emotions, or a lot of autonomy and independence. Oh, look at Kim, she can go play alone for hours in her room. Isn't that great? It's like, yeah, because what else was I going to do? I always said, right? So the tendency is going to be to go, emotions, no, thank you. And so they tend to also be less attentive when emotional content is even occurring. And what that means is that they have learned to turn away, both sort of biologically and emotionally and often even physically, from what's happening. And so part of the reason why we can see people with a more avoidant attachment system not have as many childhood memories is that actually the memories were less often encoded into the brain. We know that heightened emotion often encodes memories more, like a trauma, right? Well, when you've learned to shut down and deactivate your emotional needs again and again and again, you've learned to minimize not just your own feelings, but other people's emotions. And so your tendency might be that, oh God, my partner's upset with me, I don't want to deal with that. Or we're often with this style alexithymic, meaning that we have a hard time identifying and expressing our own emotions and feelings. And so we don't even necessarily, even if we do know or we don't know what to do with it. And so if you're, let's say, anxious and you have all these feelings and you're trying to lean in and caretake me, and that's feeling really uncomfortable for me, my tendency will be to turn away from that. And so that is the process of sort of an active, they've called it an active denial, people with this style have. And so part of our issue is learning how to lean towards and lean into our feelings and our partner's feelings. And we have to be really mindful oftentimes of, how to do that in a way that honors everybody in the room, because our tendency will be to just focus on what we need and what feels good, which is like maybe, retreating or avoiding or withdrawing or minimizing those things, like, oh, it's not that bad, or they're being dramatic or whatever. And so your challenge is to learn to identify and honor not just your partner's feelings, but yours. And once again, going back to even pausing to take time to reflect, not to remove yourself for a long time with couples conflict. We know that the quicker things are resolved, the better it is for the couple, because the more time that goes by, the more angry, the more resentful, the more the story you can create. But we do need to have a pause sometimes. but you agree to return from that pause and to be open to receiving what your partner is saying, to not just kind of tend to do your thing where you shut down or you binge watch or you work too much, but to learn to lean towards conflict and emotions and vulnerability. And lastly, the disorganized style, which really, I think sometimes this style gets a bad rap because on the extreme end, we can see some very classic borderline presentations, dissociation. But I think at the heart of it, if we look at it for many of us, if you really had unsafe parents where this is the heart of disorganized, the source of safety, the source of attachment was also the source of fear. If that is what you experienced as a baby, your parent was displaying disorganized attachment behaviors. So it is a real dilemma there because you have to always try to find ways to stay safe, but the person that could be the most, hurtful to you may have very well been your own parent, time and time again. I'm not talking about occasional once in a blue moon things. We're talking about patterns. Now, these parents might be in their own untreated mental state. They might be in their own traumas. They often are and were. But the experience, I'm talking about the initial attachment is often disorganized for us. And so we often display a mix of avoidant and anxious behaviors. It's sort of this chaos where we don't really know what to do. We might depending upon who we're with, we might lean into our more avoidant side or more anxious side. We can certainly experience both in this dynamic. And we often see ourselves, as I've said in many videos, as children of borderline and narcissistic parents, as we are bad, we are unlovable. There is some defective flaw about us. And the research shows that we often repeatedly find ourselves in unfulfilling, traumatic at times, traumatic attachment type relationships, a lot of trauma wounds, a lot of chaos, and just not ever really getting our needs met or anywhere close. And so that does show in the research that we have a tendency to be preoccupied with past hurts and a difficulty of accessing our own past memories, kind of like the avoidant I talked about, and emotions of early attachment relationships. And so in therapy, sometimes people will, this label can feel extreme, but what I'm really talking about in more general cases is how we can have very sort of flip-floppy behaviors that, in other words, I can really want to be on my own and I don't want to be suffocated or engulfed or consumed, but then I can also be afraid that once I have someone I've let in, terrified I'm going to lose them, or they're going to leave me or things like that. And so it can play out in lots of ways. But the issue for you will be that you often struggle with both types of behaviors. And yes, I'm going to make a whole bunch of videos on hopefully these topics in the next few weeks. But the idea is that you have this very early attachment, the very, very beginning of life, the first few years I'm talking about in the textbooks I'm referencing. And then as you mature, of course, you have other types of attachments and you can lean in or out to other styles. So you can be secure, but lean into anxious or avoidant, right? You can be avoidant, but occasionally have tendencies to lean into anxiousness. But I like to think of disorganized as encompassing kind of that classic push-pull we can feel, right? Because there wasn't necessarily a real organized pattern to getting our needs met. Now, there's some other arguments about, yes, there is an organization to the chaos with some other research, but at the heart of it, we're talking about some turmoil inside. And the reason why you might know you have this is that if you have a string of really traumatic relationships, there's a very good chance you have a more disorganized attachment style. Not just like, breakups, but I mean, a lot of a relational trauma. It's very likely that you have chosen partners that may reflect these different parts of your experience. Maybe one boyfriend or girlfriend or partner was very anxious and you were more avoidant, and then the flip side happened, right? So the bottom line is we're acting out these early attachment dynamics, and depending upon who we're with, that can trigger different responses, and that is true for all of our styles. Even a secure person could find themselves maybe leaning into a more unsafe relationship, and it might, because they had a parent, let's say, one of them who had those tendencies, could take them longer to recognize. But at some point, the idea is that these early attachment experiences will shape how we respond, how we see ourselves, and what we expect. So those are really how I see how we deal with conflict, how we deal with intimacy and vulnerability triggers. Whether or not we lean in or turn away is really the heart of it. And so I would just encourage you to reflect, if you want to do some more work here, about, well, how do I tend to respond to triggers around the relationships I've been in? Do I tend to want to retreat and withdraw and feel overwhelmed? Do I shut down? Do I play games? Do I try to control and manipulate? We talked this last week about all the different strategies the two of the styles can use in terms of anxious and avoidant. And so we're going to go further more into the research and conversations around these topics next week. So thank you so much for being here. Please stay safe and well. Don't forget to subscribe and to follow me on TikTok for more content around these topics. I hope you have a great weekend, and I'll see you next week.